So, good afternoon everyone. We are the group A1 and B1 and we will be discussing about the respiratory system. So, the intended learning outcomes first is to discuss about the different coverage of respiratory system. Second one is to tackle the different functions of the respiratory system. Third is to determine the different organs present in respiratory system and how they function. And the fourth is to identify the physiology that are essential in the human body. So the respiratory system. So the respiratory system is the organs that are involved in breathing, such as the nose, mouth, throat or pharynx, larynx, trachea, the large airways or the bronchi, small airways or the bronchioles, and the lungs. So, the respiratory system includes inhalation and exhalation, and upon inhalation, the diaphragm contracts and the lungs expand, allowing air to pass through the lungs. And during exhalation, the diaphragm relaxes and the air or carbon dioxide is forced out of the lungs. This process of inhalation and exhalation is known as respiration, which is approximately 20 times per minute. So, overview about the respiratory system. So, in the respiratory system, the rib cage and the diaphragm play a significant role in respiration, as the rib cage encloses and protects the lungs, and the diaphragm, which is the main muscle in charge of inflation of lungs. So, in the picture, as we breathe, the oxygen molecules enter in the nostrils and travel downwards accordingly to the pharynx, larynx, trachea, the bronchi which separates the two lungs, and within the lungs, the bronchus divides into bronchioles that delivers it into tiny sacs called alveoli, where oxygen and carbon dioxide are exchanged. Subsequently, the carbon dioxide is also released in the alveolus that travels again to the bronchioles, into the bronchus that reaches the trachea and further breathed out to the nostrils. The next one is the functions of the respiratory system. When the respiratory system is mentioned, people generally think about breathing, but breathing is only one of the activities of the respiratory system. The respiratory system also works with the circulatory system to provide this oxygen and to remove the waste products of metabolism. So the functions of the respiratory system first is it is a oxygen supplier. It is to keep the body constantly supplied with oxygen that is necessary to maintain life. Next function of the respiratory system is elimination, or it is the elimination of carbon dioxide in the body. Next is gas exchange. And during gas exchange, oxygen moves from the lungs to the bloodstream. At the same time, carbon dioxide passes from the blood to the lungs for exhalation. Next function is passageway, and passageways that allow air to reach the lungs starting from the pharynx, larynx, trachea, bronchi, and bronchioles. The next function of the respiratory system is humidifier, which it purifies, humidify, and warm incoming air. Examples are small hairs in your nose to help filter out the air, and mucus produced in the trachea and bronchial tubes to keep air passages moist. And the last function of the respiratory system is that it helps regulate pH of blood. So, regulation of blood pH. So before we start, we must always remember that when the carbon dioxide reacts with water, it forms carbonic acid which produces bicarbonate ions and hydrogen ions. So the carbonic acid in the picture is the H2CO3. So on the left side, when the blood pH level is low, it is considered as acidosis, or a condition that there is too much acid in the body fluid. So if there is too much acid in the body fluid, there will be an increase of respiration rate, or the process of inhalation and exhalation, in order to release a great amount of carbon dioxide going out from the body. After the CO2 is released from the body, then there will be a decrease of carbon dioxide in the blood, as well as decrease in carbonic acid to lessen the acidity. Then, if there is less acidity in acidosis, it will then increase its pH level to be normal or achieve homeostasis. On the right side, when the pH level of the blood is high, it is considered as alkalosis, or a condition that there is a lot of bicarbonate ions in the blood. So if there is too much bicarbonate ions in the blood, there will be a decrease of respiration rate in order to retain carbon dioxide in the body. Then the carbon dioxide will increase in the bloodstream to produce acidity through the carbonic acid, or the H2CO3. And after the increase of acidity in alkalosis, it will then decrease its pH level and achieve homeostasis. So that's all for my report.
Good day everyone, my name is Justin Marie Alvarez, and today I'm going to report about three of the organs of the respiratory system: the nose, the pharynx, and the larynx. Of all the organs of the respiratory system, the nose is the only externally visible part, and it is also the major and entrance of the respiratory system. The nose is divided into two major sections: the external nose and the nasal cavity, or the internal nose. So the external nose consists of the surface and the skeletal structure that results in the outward appearance of the nose and contribute to the numerous functions. First, we have the root. It is the region of the nose located between the eyebrows, as you can see in the picture on the slide. The bridge is the part of the nose that connects the root to the rest of the nose. The dorsum nasi, it is the length of the nose. The apex is the tip of the nose. On the other side of the apex, the nostrils are formed by alae. An alae is a cartilaginous structure that forms the lateral inside of each nares, or nostril opening. The philtrum. The philtrum is the concave surface that connects the apex of the nose to the upper lip. Next, we have our internal nose or nasal cavity. First, we have the vestibule. It is the most anterior portion of the nasal cavity. The exterior nares or nostrils lead into this portion of the nasal cavity, which is essentially just a short passageway that is supported by the cartilage of the nose and lined with tissue that contains small coarse hair called cilia that leads into the respiratory region of the nasal cavity. The respiratory region, it makes up the largest portion of the nasal cavity. Specialized tissue in this area are to aid the respiratory process. This part of the nasal cavity has ciliated cells. The ciliated cells of the nares mucosa creates a gentle current that moves the sheet of contaminated mucus towards the throat, where you can swallow and digest it by stomach juices. The olfactory region. The olfactory bulb in this region in the brain, it is receiving input from the olfactory neurons in the nasal olfactory epithelium. The olfactory nerves penetrate the roof of the nasal cavity and the cerebriform plate and innervate the superior nasal concha and upper third of the septum, or the ethmoid bone. Next, the nasal septum. The nasal septum is the wall or cartilage and bone in your nose. The middle of the nasal respiratory cavity. It is made up of septal cartilage, the vomer bone, and the perpendicular plate of ethmoid bone. The septum divides the nasal cavity inside your nose into the right and left side. Next, we have the turbinates or the nasal conchae. Inside the nasal cavity are third curved shelves of bone called turbinates. These are small structures inside the nose that cleanse the humidity air that passes through the nostrils into the lungs. The meatus are spaces between the turbinates. This space is important for the drainage of these three paranasal sinuses: the maxillary, frontal, and front of the ethmoid sinuses that is going to be discussed later. Also, the air flows through the paranasal sinuses, which creates the tone of the voice. The hard and soft palate or palate. The hard palate separates the oral and nasal cavity, bordering the oral cavity superiorly and forming the roof of the mouth, and the nasal cavity inferiorly forming its floor. The soft palate is movable, consisting of the muscle fiber sheathed in mucous membrane. It is responsible for closing off the nasal passage during the act of swallowing, and also for closing off the airway. During sneezing, it protects the nasal passage by diverting a portion of the excreted substance to the mouth. The bones. There are 12 cranial bones in total that contribute to the nasal cavity structure, which include the paired nasal, maxilla, palatine, and lacrimal bones, as well as the unpaired ethmoid, sphenoid, frontal, and vomer bones. Among all of them, the ethmoid bone is the most important element for two reasons. First, it makes the greatest portion of the nasal skeletal framework by forming the roof and the walls of the nasal cavity. Secondly, it contains the ethmoidal cells, or known less commonly as the ethmoidal sinuses. So, the paranasal sinuses. These are small, hollow spaces in the bones around the nose. We have 4 paranasal sinuses. These are formal, maxillary, ethmoidal, and the sphenoidal sinuses. As you can see in the image on the screen, the frontal sinuses is located above the eyes. The maxillary sinuses are under the eyes. The ethmoid sinus are between the eyes, and lastly, the sphenoidal sinus are behind the eyes. Their functions are lightening the weight of the head, humidity and heating inhaled air, increasing the resonance of speech, and serving as a crumple zone to protect vital structures in the event of facial trauma. Next in line for the organ in the respiratory system is the pharynx. The pharynx is a part of both digestive system and respiratory system. As a component of the upper respiratory tract, the pharynx is the part of the conducting zone for air into the lungs. Therefore, one of these primary function is to warm and humidify air before it reaches the lungs. It is divided into 3: the nasopharynx, oropharynx, and the laryngopharynx. The nasopharynx is situated in the space between the back of the nose and soft palate. It is continuous with the nasal cavity and forms the upper part of the respiratory system. It plays a very important role in transferring air from the nose to the larynx. The oropharynx. The oropharynx is a part of the pharynx located at the back of the mouth. The muscles and structure in the oropharynx allow us to breathe while chewing or manipulating material in oral cavity. Therefore, we can talk while we eat, or we can breathe while we are eating. Lastly, the laryngopharynx, also referred to as the hypopharynx. It is the most caudal portion of the pharynx, and it is crucial connection point through which food, water, and air pass. Specifically, it refers to the point at which the pharynx divides anteriorly into the larynx and posteriorly into the esophagus. Next, we have the larynx. The larynx is also called the voice box, a hollow tubular structure connected to the top of the windpipe or trachea. Air passes through the larynx on its way to the lungs. The larynx also produces vocal sounds and prevent the passage of the food and other foreign particles into the lower respiratory tract. It is located inferior to the larynx. It is formed by 8 rigid hyaline cartilage and a spoon-shaped flat of elastic cartilage. The structure. The thyroid cartilage, it is anteriorly. It is the largest hyaline cartilage. It is the shield-shaped thyroid cartilage which protrudes anteriorly and is consist of laryngeal prominence or the Adam's apple. The epiglottis. The epiglottis attached to the thyroid cartilage is very flexible piece of leaf-shaped elastic cartilage that covers the opening of the trachea. When in the closed position, the unattached end of the epiglottis rests on the glottis. The glottis is composed of the vestibular folds, the true vocal cords, and the space between these folds. In the epiglottis, we have 3 smaller paired cartilage, the arytenoids, corniculates, and the coniforms. Lastly, we have the cricoid cartilage. The cricoid cartilage forms a ring with a wide posterior region and a thinner anterior region. The cricoid cartilage serves to maintain airway patency, forms part of the larynx, and divides an attachment point for key muscles, ligaments, and cartilage, which function in the opening and closing of the vocal cords for sound production. That is the end of my report. The next organs will be discussed by my other groupmates.
Good day everyone, I am Halea and my reporting is about the continuation of the anatomy of the respiratory system. So let us start with trachea. So trachea is a long tube that extends from the pharynx and larynx to the bronchi of the lungs. It typically has an inner diameter of about 25.4 millimeters and a length of about 10 to 16 centimeters. The trachea is fairly rigid because its walls are reinforced with C-shaped rings of hyaline cartilage. The open parts of the rings abut the esophagus and allow it to expand anteriorly when we swallow a large piece of food, while the solid portions support the trachea walls and keep it patent or open in spite of the pressure changes that occur during breathing. Cricoid cartilage. Cricoid cartilage is located at the top of the trachea and bottom of the larynx, the only complete ring of cartilage in the trachea, extending downward throughout the length of the tube are about 15 to 20 C-shaped cartilaginous rings that reinforce the outer structure and shape of the trachea. The open part of each C-shaped ring reveals a membranous wall on the inside of the trachea. So tracheal cartilages is considered as hyaline cartilage, which is simple, transparent, and made primarily of collagen. The trachealis muscle connects the open ends of the C-shaped rings of cartilage and contracts during coughing, reducing the size of lumen of the trachea to increase the air flow rate. Next slide. Mucus and cilia. Mucus and cilia form the mucociliary escalator, which lines the cells of the trachea with mucus to trap inhaled foreign particles. The cilia then waft upward toward the larynx and the pharynx, where it can be either swallowed into the stomach or expelled as phlegm. Mucociliary escalator is one of the most important functions of the trachea and is also considered a barrier component of the immune system due to its role in preventing pathogens from entering the lungs. The epithelium and the mucociliary ladder can be damaged by smoking tobacco and alcohol consumption, which can make pneumonia from bacteria in the upper respiratory tract more likely to occur due to the loss of barrier function. So trachea is also considered as the conducting zone of the lungs. Trachea is important in warming and moistening air before it reaches the lungs. The trachea is also considered a part of normal anatomical dead space, which means space in the airway that is not involved in the alveolar gas exchange. Its volume contributes to calculations of ventilation and physiological dead space. It is not considered alveolar dead space, a term that refers to alveoli that don't partake in gas exchange due to damage or lack of blood supply. So next is the bronchi. So the human trachea divides into two main bronchi, also called as the main stem bronchi, that extend laterally into the left and right lung respectively at the level of the sternum. The point where the trachea divides into the bronchi is called the carina. So the right main bronchus is wider, shorter than the left main bronchus, which is thinner and longer. So the right main bronchus subdivides into three lobar bronchi, while the left main bronchus divides into two. The lobar bronchi, also called as secondary bronchi, divide into tertiary bronchi, each of which supplies air to a different bronchopulmonary segment. So a bronchopulmonary segment is a distinct region of the lung separated from the rest of the lung by connective tissue. Each bronchopulmonary segment forms a discrete functional unit in the lung that is independent of the other segments. This property allows a bronchopulmonary segment to be surgically removed without affecting other segments. So there are 10 segments in the right lung and 8 to 9 segments in the left lung due to anatomical differences. The segmental bronchi divide into many primary bronchioles that divide into terminal bronchioles. Each terminal bronchiole then gives rise to several respiratory bronchioles, which go on to divide into 2 to 11 alveolar ducts. So there are 5 or 6 alveolar sacs associated with each alveolar duct. The alveolus is the smallest anatomical unit of the lung and the site of gas exchange between the lung and the bloodstream. So next slide. So bronchi is a passageway of or airway in the respiratory tract that conduct air into the lungs. The bronchus branches into smaller tubes called bronchioles. So bronchi and bronchioles are parts of the conducting zone. They moisten and warm air and contribute to the volume of anatomical dead space. The bronchi and bronchioles are also part of the mucociliary escalator that removes mucus and pathogens from the lungs. So the subdivisions of bronchi. First is the bronchioles. So next slide. The bronchioles are part of the lower respiratory system. As they branch off from the bronchi, they become smaller and smaller, traversing the interior of each lung before ending at clusters of alveoli. There are three types categorized by size. One is the lobular bronchioles, which are larger passages that first enter the lobes of the lungs. Two, respiratory bronchioles, two or more branches from each terminal bronchiole that in turn lead to 2 to 10 alveolar ducts. And the terminal bronchioles, 50 to 80 smaller passages in each lung. The lobular and terminal bronchioles are sometimes referred to as dead space because no air exchange occurs in these passages. The functions of the bronchioles is to deliver air to a diffuse network of around 300 million alveoli in the lungs. As you inhale, oxygenated air is pulled into the bronchioles. Carbon dioxide collected by the alveoli is then expelled from the lungs as you exhale. So the next one is alveoli. Next slide, please. Alveoli are classically described as a cluster of grapes, with each alveolus being a separate identity from the one surrounding it. Their shape is polygonal with flat side rather than spherical, and each alveolus shares a common wall with its neighbors. The wall shared by two neighboring alveoli is called the interalveolar septum. It consists of a single layer of alveolar epithelial cells, capillary endothelial cells, and a variety of interstitial tissue in between. There are two distinct types of alveolar epithelial cells, namely type 1 and type 2 pneumocytes. Type 1 pneumocytes cover around 95% of the entire surface area of alveoli and provide an excellent space for gas exchange. Type 2 pneumocytes produce surfactant, a vital substance that decreases the effects of surface tension. They also function as stem cells that differentiate into both types of alveolar cells following lung damage. So alveoli are the endpoint of the respiratory system. The respiratory process starts when you inhale air into your mouth or nose. The air travels down the trachea. Then the air travels through airways called the bronchi and into the lungs. From there, the air is directed through smaller and smaller passages called bronchioles. The air moves through a tiny duct called alveolar duct and finally enters an individual alveolus. Alveoli are lined by a fluid called surfactant. This fluid maintains the shape of the air sac and helps keep it open so that oxygen and CO2 can pass. The oxygen molecules move through a single layer of lung cells in the alveolus, then through a single cell layer in a capillary to enter the bloodstream. So CO2 is a byproduct of the process in cells that uses oxygen to produce energy. As oxygen moves out of the alveolus, CO2 molecules pass into it. They are then breathed out of the body through the nose or mouth. So lastly, let's proceed to lungs. So next slide. So the lungs are pyramid-shaped paired organs that are connected to the trachea with the right and left bronchi. On the inferior surface, the lungs are bordered by the diaphragm. It is enclosed by the pleurae, which are attached to the mediastinum. The right lung is shorter and wider than the left lung, and the left lung occupies a smaller volume than the right. So the cardiac notch is an indentation on the surface of the left lung, and it allows space for the heart. The apex of the lung is the superior region, whereas the base is the opposite region near the diaphragm. The costal surface of the lung borders the ribs. The mediastinal surface faces the midline. So each lung is composed of similar units called lobes. Fissures separate these lobes from each other. So the right lung consists of 3 lobes, which are the superior, the middle, and the inferior lobes. and the left lung consists of two lobes, the superior and the inferior lobes. A bronchopulmonary segment is a division of a lobe, and each lobe houses multiple bronchopulmonary segments. Each segment receives air from its own tertiary bronchus and is supplied with blood by its own artery. Some diseases of lungs typically affect one or more bronchopulmonary segments, and in some cases, the diseased segments can be surgically removed with little influence on neighboring segments. A pulmonary lobule is a subdivision formed as the bronchi branch into bronchioles. Each lobule receives its own large bronchiole that has multiple branches. An interlobular septum is a wall composed of connective tissue which separates lobules from one another. So, the physiology of the lungs, number one, is the blood supply. The major function of the lungs is to perform gas exchange, which requires blood from the pulmonary circulation. This blood supply contains the oxygenated blood and travels to the lungs where erythrocytes, also known as red blood cells or RBC, pick up oxygen to be transported to tissue throughout the body. The pulmonary artery is an artery that arises from the pulmonary trunk and carries the oxygenated arterial blood to the alveoli. The pulmonary artery branches multiple times as it follows the bronchi, and each branch becomes progressively smaller in diameter. One arteriole and an accompanying venule supply and drain one pulmonary lobule. As they near the alveoli, the pulmonary arteries become the pulmonary capillary network. The pulmonary capillary network consists of tiny vessels with very thin walls that lock smooth muscle fibers. So the capillaries branch and follow the bronchioles and structure of the alveoli. It is at this point that the capillary wall meets the alveolar wall, creating the respiratory membrane. Once the blood is oxygenated, it drains from the alveoli by way of multiple pulmonary veins which exit the lung through the hilum. Second is the nervous innervation. Dilation and constriction of the airway are achieved through nervous control by the parasympathetic and sympathetic nervous system. The parasympathetic system causes bronchoconstriction, whereas the sympathetic nervous system stimulates bronchodilation. Reflexes such as coughing and the ability of the lungs to regulate oxygen and carbon dioxide levels also result from this autonomic nervous system control. Sensory nerve fibers arise from the vagus nerve and from the second to the fifth thoracic ganglia. The pulmonary plexus is a region on the lung root formed by the entrance of the nerves at the hilum. The nerves then follow the bronchi in the lungs and branch to innervate muscle fibers, glands, and blood vessels. So let's proceed to the pleura of the lungs. Next slide. Each lung is enclosed within a cavity that is surrounded by the pleura. The pleura is a serous membrane that surrounds the lungs. The right and left pleurae, which enclose the right and left lungs, respectively, are separated by the mediastinum. The pleurae consist of two layers. The visceral pleura is the layer that is superficial to the lungs and extends into and lines the lung fissures. In contrast, the parietal pleura is the outer layer that connects to the thoracic wall, the mediastinum, and the diaphragm. The visceral and parietal pleurae connect to each other at the hilum. The pleural cavity is the space between the visceral and parietal layers. So the pleurae perform two major functions. They produce pleural fluid and create cavities that separate the major organs. Pleural fluid is secreted by mesothelial cells from both pleural layers and acts to lubricate their surfaces. This lubrication reduces friction between the two layers to prevent trauma during breathing and creates surface tension that helps maintain the position of the lungs against the thoracic wall. This adhesive characteristic of the pleural fluid causes the lungs to enlarge when the thoracic wall expands during ventilation, allowing the lungs to fill with air. The pleurae also creates a division between major organs that prevents the interference due to the movement of the organs while preventing the spread of infection. So that is all for my reporting. Let us now proceed to the physiology of the respiratory system, which will be reported first by Martina. Thank you.
Good day everyone, my name is Martina Isabel Coycong and I will be reporting about the physiology of the respiratory system. So let us first start with a discussion about respiration. So what is respiration? So respiration is the movement of the oxygen from the outside environment to the cells within tissues and removal of carbon dioxide in the opposite. Physiological respiration involves respiratory cycles of inhaled and exhaled breaths. Physiological respiration involves the mechanism that ensures that the composition of the functional residual capacity is kept constant and thus throughout the body. Next, the gas exchanges in the lungs occur by ventilation and perfusions. The external process of the respiration involves the transfer of oxygen and carbon dioxide that occurs in the lungs between the atmosphere and the pulmonary circulation. The internal process of respiration is similar process that occurs of respiration in a similar process that occurs at the cellular level. Next is the impairment of effective respiration, the pathology. In the healthy individual, the breathing cycle is silent, automatic, and effortless. Many disease states that affect the respiratory system and interfere with the O2 and nutrients required for normal circular metabolism. Next, we have the disruption in ventilation is the most common respiratory complications we encounter in the field. Next, we have the disruption in perfusion. We have the hemoglobin in the component of the blood that transports in O2. Okay, that is for all discussion. Thank you.
Hello everyone, I am Rosalda Ida Los Santos. So now let's talk about the mechanics of breathing. So, in Boyle's law, it states that the volume of the gas is inversely proportional to pressure. When temperature is constant, therefore the volume of the thoracic cavity increases, the volume of the lungs increases, pressure within the lungs decreases. So, when the volume of the thoracic cavity decreases, the volume of the lungs decreases, while the pressure of the lungs increases. So, here in mechanics of breathing, the process of inspiration means breathing in and expiration means breathing out are vital for providing oxygen and tissues and removing carbon dioxide from the body. Inspiration occurs via active contraction of muscles such as diaphragm, whereas expiration tends to be passive unless it is forced. So, let's talk about inspiration. So, in inspiration, air is flowing into the lungs. Means we breathe in. It is initiated by the contraction of the inspiratory muscles, which is the diaphragm and the external intercostal muscles. So, the action of inspiration, Here, the action of the inspiratory muscles results in an increase in the volume of the thoracic cavity as the lungs are held against the inner thoracic wall by pleural seal. They also undergo an increase in volume. As per Boyle's law, an increase in lung volume results in decrease in the pressure within the lungs. The pressure of the environment external to the lungs is now greater than the environment within the lungs, meaning air moves into the lungs down the pressure gradient. Next, we have the passive expiration, means air is leaving the lungs, so means we breathe out. It is initiated by the relaxation of the inspiratory muscles. The relaxation of inspiratory muscles results in a decrease in the volume of the thoracic cavity. The elastic recoil of the previously expanded lung tissue allowed them to return to their original size. As per Boyle's law, a decrease in lung volume results in an increase in the pressure within the lungs. So the pressure inside the lungs is now greater than the external environment, meaning air moves out of the lungs down the pressure gradient. So let's get to know the forced breathing. So in forced breathing, it is an active mode of breathing in which it utilizes additional muscles to rapidly expand and contract the thoracic cavity volume. It also occurs during exercise. Next, we have the intrapulmonary volume. It is the volume within the lungs. So, intrapleural pressure, it is the normal pressure within the pleural space. It is always negative. It is also the major factor in preventing the collapse of the lungs. Next, we have the non-respiratory air movements. It is the result of reflex activity, but some may be produced voluntarily, such as cough, sneeze, crying, laughing, and hiccups, and yawn. So that's all for the mechanics of breathing. Next reporter, please.
The respiratory volumes and capacities to be reported by Wency de Vinagracia.
Tidal volume measures the amount of air that is inhaled and exhaled during a normal breath. Inspiratory reserve volume, amount of air that can be inhaled after normal inhalation. Expiratory reserve volume, it is the amount of air that is being exhaled in a normal exhalation. Residual volume, amount of air that is left after expiratory reserve volume is exhaled. That is all. Thank you.
Vital capacity, volume that can be exhaled after maximum inspiration to maximum expiration, used to evaluate your lung function. It measures the effect that your lung disease has on your ability to inhale and exhale. So the purpose of this is to know the amount of air that the lungs can expel after having been filled completely. The vital capacity represents the change in volume from completely emptied lungs to completely filled lungs. In human medicine, vital capacity is an important measure of a person's respiratory health. Dead space volume, the volume of air that is inhaled that does not take part in the gas exchange because it either remains in the conducting airways or reaches alveoli that are not perfused or poorly perfused. In other words, not all the air in each breath is available for the exchange of oxygen and carbon dioxide. Functional volume, the requisite number of repetitions an athlete in the sport of fitness needs to build towards within their training design. The volume of air present in the lungs at the end of passive expiration. It is also the amount of air remaining in the lungs after a normal physiologic expiration. Spirometry, the measurement of the volume of air that a person can move into and out of the lungs. Simple test used to help diagnose and monitor certain lung conditions by measuring how much air you can breathe out in one forced breath. So how spirometry is performed? During the test, you will be sitting upright. A clip is placed on your nose and you will be given a plastic mouthpiece connected to the spirometry machine. You will place your lips tightly around the mouthpiece and be asked to take in as big and a deep breath as possible, and then blow out as hard as fast as you can.
We will talk about the respiratory sounds. The two main types of breath sounds are bronchial and vesicular. Doctors define these categories based on the sound's intensity and pitch, as well as the relative duration of its inspiratory and expiratory phases. Let's check the next slide. We will talk about now the external and internal respiration. So I will just compare this. For external respiration is basically the transfer of gas between respiratory organs such as the lungs and the outer environment. It takes place prior to internal respiration, while the internal respiration is the transfer of gas between the blood and the cells. It's also known as the breathing, refers to a process of inhaling oxygen from air into the lungs and expelling carbon dioxide from the lungs to the air. So the exchange of gases both in and out of the blood occurs simultaneously. So it's a physical process which oxygen is taken up the capillaries of lung alveoli and carbon dioxide is released from the blood. However, internal respiration or tissue respiration, or what we call the cellular respiration, refers to a metabolic process in which oxygen is released to tissues or living cells and carbon dioxide is absorbed by the blood. Once inside the cell, the oxygen is used for producing energy in the form of ATP or what we call adenosine triphosphate. So I have some example. For external respiration, a large water buffalo exchanges oxygen and carbon dioxide in the lungs. Also, a spider passes air over an organ called a book lung, which cycles oxygen with the blood. So the two animals have obvious organs dedicated to the exchange of gases to and from the blood with the external environment, which is what we call external respiration. For internal respiration, the best example of this is a hagfish does not have a closed respiratory system, but rather a system of blood-filled sinuses that exchange oxygen and carbon dioxide with the interstitial fluid. So, internal respiration is the process of getting oxygen to the cells. So, let's check now the respiratory gas transport. May I just ask you guys, what transport method is used by the respiratory gases to cross cell membranes? So if you do not know that, the answer is simple diffusion. Next, do you know where does gas exchange happen in the respiratory system? So it occurs in the lungs between the alveoli and the network of tiny blood vessels called the capillaries, which are located in the walls of the alveoli. So next, may I ask you which gases are exchanged during the respiration? Of course, the oxygen and the carbon dioxide. So let's check now the respiratory gas transport. May I just ask you guys, what transport method is used by the respiratory gases to cross cell membranes? So if you do not know that, the answer is simple diffusion. Next, do you know where does gas exchange happen in the respiratory system? So it occurs in the lungs between the alveoli and the network of tiny blood vessels called the capillaries, which are located in the walls of the So next, may I ask you which gases are exchanged during the respiration? Of course, the oxygen and the carbon dioxide. So, how is the respiratory and the cardiovascular system works in the tandem to transport oxygen and carbon dioxide around the body? So, if you can see here on the image, once the respiratory gases have diffused in the lungs, resulting in the blood becoming oxygen-rich and carbon dioxide being exhaled, so the next stage of the transporting of the oxygen-rich blood to the tissues that need it takes place. At the same time, the next batch of carbon dioxide-rich blood must be brought to the lungs for the process to take place again. So the transportation of gases throughout the body takes place in the bloodstream through the action of the cardiovascular system, which is the heart and the blood vessels, as can be seen in the adjacent image right now on the screen. Then oxygenated blood leaving the lungs flows back to the heart via the pulmonary veins, and is then pumped to the rest of the body from the left ventricle via the aorta and its branches. So guys, the amount of the hemoglobin in the blood determines its oxygen carrying capacity. Increases in carbon dioxide or temperature will also decrease the ability of the oxygen to bind to hemoglobin. This in turn leads to a decrease in performance, as less oxygen means less production of energy through aerobic metabolism. So as the oxygen-rich blood reaches the capillaries, gas exchange occurs. Oxygen is delivered to the tissues, and the deoxygenated blood, which is loaded with carbon dioxide, leaves the tissues of the body and flows back to the heart, when it is pumped to the lungs via the pulmonary arteries. So once carbon dioxide is transported to the lungs, it diffuses out of the capillaries into the alveoli and exhaled out of the lungs. So that is how the respiratory and cardiovascular systems work in the tandem to transport oxygen and the carbon dioxide around the body.
Okay, let's discuss about the parts or the role of the controlled respiration. So, what is the neural regulation of the respiratory system? The neural control of respiration refers to functional interactions between networks of neurons that regulate movements of lungs, airways, and chest wall and abdomen in order to accomplish effective organismal uptake of oxygen and expulsion of carbon dioxide, airway liquids and irritants, and regulation of blood pH. So, there are 5 examples of neural regulations or gaandar siya sa neural regulations. First, we have the phrenic and the intercostal nerves. These are controlled by the respiratory center and issue rhythmic nerve impulse, causing synchronous contraction and diastolic activity of the diaphragm and intercostal muscles to produce respiratory movement. So, the phrenic nerve is among the most important nerve in the body due to its role in respiration, because ang phrenic nerve provide sa primary motor to supply the diaphragm. So, this is the major respiratory muscle.
Ang intercostal nerve naman niya are important for normal respiration, in particular by innervating the intercostal and the abdominal muscle. So they are essential to cough and sneeze. Next is the medulla and pons. The medulla oblongata, whatever you call that, is the primary respiratory control center. Its main function is to send signals to the muscle that control respiration to cause breathing to occur. So, may ara duwa ka regions ang medulla that control respiration. First is the ventral respiratory group, which stimulates expiratory movements. And the second one is the dorsal respiratory group that stimulates inspiratory movements. Next, eupnea. I think ang eupnea is na-include niya siya sa breathing pattern, which is eupnea is normal, good, unlabored breathing, sometimes known as quiet breathing or resting respiratory rate. So, yeah. Basta I think ang may niya ara na siya sa breathing patterns like bedypnea, tachypnea. Last but not the least, hyperpnea. It is the term for taking deeper breath than usual, which increases the volume of air in the lungs. This condition is often a response to an increase in metabolic demand when body needs more oxygen, such as during exercise. Most people, yes, basta hyperpnea ang term for breathing in more air than you normally do. It's your body's response to needing more oxygen.
Non-neural factors influencing respiratory rate and depth. So, first is the physical factors. Although the medulla's respiratory centers control the basic rhythm of breathing, there's no doubt that physical factors like talking, coughing, and exercising can affect the rate and depth of breathing, as well as an increased body temperature, which raises the rate of breathing. So next is the volition. A voluntary respiratory act in humans is associated with reductions in background spontaneous breathing. Specific respiratory behaviors, such as breath holding, show evidence of this inhibition. When the oxygen supplies in the body is getting low or the blood pH is lowering, the respiratory centers simply reject messages from the brain. And next is the emotional factors. Breathing patterns shift in reaction to emotions including sadness, happiness, excitement, and fear. Emotional states, on the other hand, alter the pattern, rate, and depth of breathing. However, it may be assumed that more intense responses to negative emotions such as fear, wrath, and anxiety results in shallower, faster breathing. This could lead to a drop in blood carbon dioxide levels. And so the chemical factors, although several factors can affect respiratory and rate, and depth, chemical factors such as carbon dioxide and oxygen levels in the blood are the most significant. The most major stimuli that cause an increase in the rate and depth of breathing are increased carbon dioxide levels and decreased blood pH. So next is the hyperventilation. Hyperventilation occurs when the breath faster and deeper than usual. So it reduces the amount of a gas in the blood. You may feel lightheaded, have a faster heartbeat, and be short of breath as a result of this decrease. The concentration of carbon dioxide in the blood is the main impact of hyperventilation. More carbon dioxide diffuses from the circulation and is expelled into the atmosphere when the rate and depth of breathing increases. So, for the hypoventilation, the body is unable to effectively remove carbon dioxide during hypoventilation. This can result to the lungs' inefficient use of oxygen. As a result, the body produces more carbon dioxide and has insufficient oxygen. Hypoventilation occurs when the lungs are unable to properly exchange the gases oxygen and carbon dioxide. It can cause complications such as respiratory acidosis, and it can be fatal if not treated.
And that is all for the reporting of A1 and B1 for the respiratory system. And this time we are ready for questions and clarifications. Thank you so much for listening.